talk about heart health, most people immediately think about cholesterol numbers, blood pressure readings, sugar levels, ECG reports, angiograms, and medications. But what many do not fully understand is that the human heart is not just a mechanical pump. It is an organ deeply influenced by emotions, stress, relationships, trauma, and psychological well-being. And modern research from institutions such as the American Heart Association and the World Health Organization has repeatedly shown that emotional health and cardiovascular health are inseparably linked. When you experience chronic stress, your body releases stress hormones like cortisol and adrenaline, which are helpful in short bursts but harmful when elevated for long periods, leading to increased blood pressure, inflammation in blood vessels, endothelial dysfunction, higher heart rate, insulin resistance, and gradual damage to the arteries. And over months and years, this silent strain can accelerate atherosclerosis and increase the risk of heart attack, stroke, arrhythmias, and even heart failure. Consider how grief feels physically heavy in the chest, how anxiety creates palpitations, how anger makes your heart pound, and how loneliness can feel like a pressure that does not go away. These are not imaginary sensations but measurable physiological responses. Because the heart and brain communicate constantly through the autonomic nervous system, and when emotional distress becomes chronic, the sympathetic fight-or-flight system stays activated while the calming parasympathetic system remains suppressed, reducing heart rate variability, impairing recovery, and placing continuous strain on the cardiovascular system. Studies have also shown that depression doubles the risk of developing heart disease and worsens outcomes in patients who already have cardiac conditions, while social isolation has been found to increase mortality risk in a manner comparable to smoking. And this tells us something profound. Healing the heart requires more than pills and procedures. It requires emotional awareness, connection, forgiveness, resilience, and intentional stress management. Many patients who come to cardiac clinics focus solely on diet and exercise, which are absolutely essential, but they often ignore unresolved emotional burdens, work-related burnout, chronic relationship stress, suppressed anger, or persistent anxiety, all of which continuously elevate stress hormones. And blood pressure. When you carry emotional pain without processing it, your body carries it too, and the arteries respond to that internal environment. However, there is hope and empowerment in understanding this connection, because emotional healing can actively improve cardiovascular outcomes. Practices such as mindfulness meditation have been shown to lower blood pressure, reduce inflammatory markers, and improve heart rate variability, while regular physical activity not only strengthens the heart muscle but also releases endorphins that elevate mood and reduce stress, creating a positive feedback loop between mind and heart. Deep breathing exercises stimulate the vagus nerve and activate the parasympathetic nervous system, slowing heart rate and promoting relaxation within minutes. And even simple acts such as spending time with loved ones, expressing gratitude, journaling emotions, or seeking professional counseling can significantly reduce chronic stress load. Forgiveness, though often misunderstood, is another powerful cardiovascular protector because holding on to resentment keeps the stress response activated, whereas letting go reduces sympathetic overdrive and lowers blood pressure. Sleep also plays a critical role in emotional and cardiac health, as poor sleep increases cortisol, raises blood pressure, and worsens mood regulation, further stressing the heart. Nutrition contributes not only physically but emotionally, as diets rich in fruits, vegetables, whole grains, nuts, and omega-3 fatty acids support both brain chemistry and vascular health, while excessive processed foods, sugar, and alcohol can destabilize mood and promote inflammation. Building resilience does not mean suppressing emotions but rather acknowledging them, processing them, and developing coping strategies that prevent prolonged physiological stress responses. Therapy, support groups, spiritual practices, structured relaxation techniques, and structured daily routines all create stability in the nervous system, which translates into stability for the heart. And for patients who already have heart disease, emotional care becomes even more important because anxiety about recurrence, fear of exertion, and post-event depression can significantly affect recovery, adherence to medication, participation in cardiac rehabilitation, and overall prognosis. Therefore, loving your heart means more than avoiding fried food or checking cholesterol. It means protecting your peace, setting boundaries, prioritizing meaningful relationships, engaging in regular physical movement, nourishing your body wisely, sleeping adequately, and addressing emotional pain before it becomes chronic physiological damage. Your heart responds to how you live, how you think, and how you feel, and when you intentionally cultivate calmness, gratitude, compassion, and connection, you create a biochemical environment that supports vascular health, balanced blood pressure, stable rhythms, and long-term resilience. Emotional well-being is not a luxury or an abstract concept, but a core pillar of preventive cardiology, and the most powerful prescription is often a combination of medical science and mindful living. Medication when needed, lifestyle optimization always, and emotional healing as an essential, ongoing practice. So as you move forward, remember that every act of self-care, every moment of stress reduction, every honest emotional conversation, and every effort to nurture meaningful connection is not only healing your soul but actively protecting your heart. Because when you truly love your heart, you give it the calm, nourishment, and balance it needs to beat strongly for decades to come.